Okay, everyone, if we can take our seats, we want to get started. I'll give you a couple of seconds to do that. Okay. Oh, it got quiet pretty quickly. I'm impressed. I didn't think I had that power. I had no idea. Okay, so if I could have everyone's attention, please. We're going to get started with our next session, which is on the roles of corporate philanthropy, CSR, and shared value. And to speak and moderate that session, it's my pleasure and honor to introduce Jane Wales. Jane is President and CEO of the World Affairs Council of Northern California, President and co-founder of the Global Philanthropy Forum, Vice President, Philanthropy and Society, and Director of the Program on Philanthropy and Social Innovation at the Aspen Institute. She also hosts the nationally syndicated weekly national public radio show, It's Your World. Jane?
Thank you. If I'd known you had this degree of authority when you ask people to hush up, I would have had you over for Thanksgiving when I really needed you in our household. I mean, let me just thank the folks who organized this, because it's pretty incredible. You all know Rachel Priakia also played an extraordinary role, and of course the host committee. But for those of us who had to be herded and sort of kept on point and on course, Rachel, thank you so much. That's even harder than quieting the Wales family. So, I just wanted to say one other thing, because I'm looking right at Jessica. My only disappointment with this book is that you didn't do the biographies of the planning committee, because every time I see Jessica Hertzstein, I wonder what the heck I've done with my life, because she's so accomplished. So anyway, thanks so much for being here. My job is supposed to be to delineate among three of the quivers in the bow of corporations when it comes to health: corporate philanthropy, corporate social responsibility, and shared value. And I will get to that. But let me just warn you in advance that although I'm going to try to make it sound incredibly tidy, and I'll probably be correct in theory, the reality is different companies use language differently, number one, but also most companies, most of the folks in the room, certainly the folks on this panel that's upcoming, they care more about outcomes than methods, right? So they are happy to switch among the three according to the task at hand. So I'll make it sound very tidy, but know that none of that's true. Just want to be honest about that. All of the things we're going to talk about in the next panel will take place in the context of a world of public-private partnerships. I mean, you can never maximize the return on any of these efforts without those public-private partnerships. And so, given that that is the topic of the overall day, or 2 days, and as well as each of the panels, I wanted to talk a little bit about partnerships and do so through two lenses. One is the Global Philanthropy Forum, and that is a learning network of high net worth individuals who are committed to international causes. They tend to be a bit audacious in their philanthropy. They are very results oriented, and that they know that their philanthropic ambitions outstrip their capacity. Doesn't matter how large their philanthropy is, their ambitions are always larger. And so they're enthusiastic about any form of leverage, any way to partner with others and benefit from the capabilities they bring to the table. And the second lens that I look at these issues through is the Aspen Philanthropy Group. The APG is a gathering, it's a sort of an agenda-setting body of CEOs of major staffed foundations. And they look at the kinds of issues that would benefit from a much closer examination by not only foundations, but those they support. I'm going to grab a little bit of water. The starting point of the Aspen Philanthropy Group is that they are in a world that is changing, that the roles of philanthropies, of foundations, as well as for their leaders, are changing dramatically. as a function of broad secular trends that are changing the rest of the world. That is to say, the decentralization of decision-making and authority on the one hand, much greater expectations about accountability and transparency. And then the third great trend affecting their roles is the fact that there are so many new actors who are able to affect social change and who are willing to affect social change, which is the case for everybody in this room. And so last time they got together, which was in August, we asked them, well, gee, if your role is changing and if you're operating in a dynamic environment and if you care about leveraging others, imagine for us who your potential partners might be 10 years hence in 2025. Who would they be? And does your foundation have the right culture and the right capabilities in order to take advantage of the opportunity to partner with them? And so I'm going to talk a little bit about each of the categories they put forth. And the first is high net worth individuals. These are folks with extraordinary resources and a desire to be strategic. I'm thinking of people like Prince Alawid of Saudi Arabia, whose foundation, when it's fully capitalized, will be the third largest in the world at $32 billion. Or this week we had that announcement of the Chan Zuckerberg initiative with Priscilla Chan and Mark Zuckerberg. They're going to be transferring up to $1 billion a year over to their philanthropic endeavor. They have said publicly that what they want to do is learn from other philanthropists, learn from other foundations, learn from other social actors. It's clear that opportunities presented by people like Prince Alawid and the Zuckerbergs are large. Yet, of the foundations present in the room, only one had hired donor advisors, only one works with high net worth individuals that have got assets larger than those foundations. Yet they don't have the knowledge base, they don't have the data, they don't have the strategy. And so it's an opportunity thus far missed. The second category they've looked at is private sector corporations. And basically, as you all know, ever since the Green Revolution, ever since Ford and Rockefeller and Monsanto got together, ever since there was an embracing of the notion of public-private partnership and of the use of R&D and of tech transfer as levers for change, there's been some understanding, at least amongst the most sophisticated foundations, of the opportunity to leverage those capabilities within governments. So we do have real experience, and of course, since then, the Gates Foundation, Rockefeller, and others have invested in pharmaceuticals that would do research into cures for the diseases of the poor. Those examples are legend, particularly in this group. But while there has been in the past a focus on companies with substantial R&D capability or with marketing know-how or a distribution network and capability. Less has been on some other industries, other sectors that have caught their attention now. And in particular, I point to the financial services sector there and the role it's playing now in social change. And I have to say I have to include in that the investment world of Abraj Capital and others. Abraj is in there. Financing. I know about the hospitals, Fred, in Kenya that Abraj has invested in. Kenya is a place where you either go to London for your health because you're wealthy or to the very fancy private hospitals, or you're caught in a really dysfunctional health system, a difficult health system. And so Abraj Capital is in a position to help make a difference and provide care in the middle of the population. But there's also a partnership between a Dutch private equity firm and Safaricom, the telecom company in Kenya, with its M-Pesa mobile payment system, along with a Dutch foundation, to try to create a prepaid insurance model. Just remember that pretty much everyone in Kenya is in the gig economy. Pretty much the world's poor is in the gig economy, something we now romanticize here, but a world without benefits, without health insurance, et cetera. So these kinds of interventions have proven very important. Having said that, There was only one foundation in the room that had hired from the private sector, that recognized the need to, that showed through the kind of capability they had resident in their organization, that they acknowledged the need to reach out to and engage the private sector. I should note, both examples is the same foundation. The third category they looked at was, of course, the public sector. And traditionally, the way foundations have looked at the public sector is they said, well, it's our job to demonstrate that an approach works, but it's the job of government to take that idea to scale. Now, increasingly with Ebola, with the Detroit bankruptcy, with the failure of states right now, increasingly foundations are asking themselves, gee, is my job to hand over a tested idea, or is my job to shore up the capabilities of accountable governments? And so that's why you'll see folks like the Gates Foundation, even after taking a very disease-specific approach when it came to polio, has now come to the view that if they don't leave a strengthened health system in the wake of that effort, any gains they make cannot be sustained. Right? So you're going to hear from this panel a lot about health system strengthening, but that recognition that strengthening accountable governments is terribly important. Having said that, not that many foundations are sophisticated about working with governments, so it is an area of growth. And let me just say that same foundation knew it needed policy change, and in fact hired a bunch of political operatives, as well as hiring out of the healthcare industry. Then finally, the fourth sector that I would point to is the engaged public. And now, it's always been high leverage, right? And particularly in health. A lot of the issues that have been talked about so far today are going to be the result of millions of individual choices. So informing those choices becomes the ultimate form of leverage. And now with the social media, digital media, philanthropies have a new opportunity to reach individuals with message of preventive health. And so we have folks like the Bloomberg Philanthropies going into China with an anti-smoking campaign and partnering with Sino Weibo, basically the equivalent of Twitter in China, in their effort to to make people aware of the dangers of smoking. And so there'll be examples, in fact, from this panel of just that as well. But let me just say that Robert Wood Johnson's foundation, which is not on this upcoming panel, has certainly embraced that notion of engaging individuals and helping to inform individual choice and helping individuals inform each other of individual choice in its efforts to build that culture of health is really, quite brilliant, and certainly embraces that world that we're going to. I mentioned these set of potential allies that were considered by the Aspen Philanthropy Group really for two reasons. And the first is a very optimistic one, which is to say there are so many capable actors who are saying social change is an important part of my mission that it feels almost inevitable that a culture of health and well-being will be something that is achieved. But having said that, we're not set up to seize that moment. At least the world in which I operate, the world of private foundations, we're not yet set up to take full advantage of that opportunity. So a lot of what I hope we'll talk about is not from the private philanthropy's point of view, but from all of our points of view. How are we going to seize this opportunity that keeps presenting itself? Are we ready? Now, I've got this job, and I'm going to do it, of trying to tell you the difference between CRS, on the one hand, corporate philanthropy on the other, and then finally shared value. If you don't have the shared value stuff memorized by now, I'll do a pop quiz. So CRS, let me just say that we're lucky that Paula Luff will be joining us from Hess, because Hess actually has got a clean and crisp definition of CRS, so I'll mess it up for you and let her fix it when she comes on up. I think of CRS as having two goals with a very clear-eyed view of the relationship between those two objectives. And that one goal is to serve stakeholders, employees, the communities in which they operate, even their consumers, and a much wider world. So that's goal number one. Goal number one contributes to goal number two, which is to enhance the efficacy and profitability of the company itself. And there's this understanding of the connection, even though it's a cost center, that you can't do the direct connect the dots to resources. There's still an understanding that there is a relationship between the two. It's reputation driven, it's relationship building, but it also results in real outcomes and real benefits. When Paula speaks, I'm going to ask you to think about two things, and that is that at Hess, they seem to hold two concepts in mind. And one is the concept of being a guest in the local communities in which they operate. And just like good guests, you come with a house present, you offer to help do the dishes, you do those things that make people want you in their guest room. And you will continue to be welcome in that guest room, particularly if the guest room that you leave behind is even tidier than the one you found. So I keep falling back to my experience over Thanksgiving, sorry. The second concept that Hess embraces is a notion of global corporate citizenship. And here you go way beyond the communities that are directly served. Hess really does. Hess embraces the norms, doesn't just embrace the norms of human rights, worker rights, environmental standards, but it says, we're a part of shaping those norms and advancing those norms, and we're active in the global compact as an example of that. So that's corporate social responsibility. Shared value. Now, David is from Barish, is from GE, and we'll talk about GE. His remit within GE is the foundation, and that's most of his remit on this panel. So I'm going to take advantage of the opportunity myself to say something about its role in shared value, because it is an extraordinary example of a shared value company. It has invested, I actually don't know how much, but it is the billions. Mark actually referenced this, into R&D, into companies that will basically produce products that are accessible to the poor. They're well designed for a situation in which, an environment in which the infrastructure basically isn't there. That's where you see things like the electrocardiogram machine that they've come up with that is battery powered, so you can operate it in a place where there is no reliability when it comes to electricity, which is a large part of the world, and it's portable and affordable. But what's most interesting to me about GE is not the products they've adapted, or the new products they've introduced, and the investments they've made in doing so, but it's their way of actually going about producing that product. Their notion of working in-country, I think you call it in-country, for-country approach, that is creating jobs. It is also bringing to GE an understanding of the local environment, the local market that you might not otherwise have. And perhaps it's also contributing to keeping some brain power in country. Now I'll turn to corporate philanthropy, to strategic philanthropy, and Purvi will talk about it from the perspective of Medtronic. There's a situation which is just like a private philanthropy, where you set an objective, you devise a strategy, and you then measure the outcomes, and it is all without regard to the interests of the company. However, it may tap into the expertise of the country, knowing that it has got knowledge to bring to bear, that specialized knowledge to bring to bear. In this case, the goal is a 25% reduction in premature mortality due to non-communicable diseases. Fred earlier talked about how urbanization has corresponded or correlated with an expansion of non-communicable diseases. And of course, all of us know that the development community for a very long time focused only on infectious diseases, so this is an important next step. Now, having dutifully done my job, you will see that I am basically right only in theory, and now I'm going to invite the panelists to come join me, and please applaud them.